Today we will discuss the placenta previa. So what is placenta previa? Definition of placenta previa, what are the etiological factors and what are the risk factors, and what are the clinical manifestations, and what is the diagnosis, and what is the management of the placenta previa. So before going to study about the placenta previa, we will look at the overview of the placenta. So in the overview of placenta, we are going to study and what is the placenta and why it is situated, and what is the function of the placenta. So to say literally, the placenta is a structure which is developed inside your uterus during the pregnancy. So the main function of the placenta is it provides oxygen and nutrients for the newborn baby. So how the transportation of this oxygen and nutrients takes place means so through the maternal. So what the maternal blood and the maternal nutrients and oxygen supplementation it takes place from the placenta to umbilical cord, and from the umbilical cord to the baby. So this is the process of the transportation of the nutrients and blood and other essential things from the maternal to fetus. It takes place by the maternal to the placenta, and placenta to the umbilical cord to the fetus. So normal in most pregnancies, the placenta attaches at the top or side of the uterus. As we all know that uterus is divided into two segments, that is upper uterine segment and lower uterine segment. So this placenta will attach to the top of the uterus is nothing but that is upper uterine segment or side of the uterus So this is the overview of the placenta. Next, we will see the definition of placenta previa. If the placenta is implanted partially or completely over the lower uterine segment, then it's called as placenta previa. So I already told you that placenta is situated in the upper uterine segment or side of the uterus, but due to some etiological factors or morphological factors, the placenta gets implanted partially or completely onto the lower uterine segment. It is called as a placenta previa. So this is the definition of the placenta previa. Now we will discuss what are the etiological and risk factors of placenta previa. The first is if the fertilized egg is implanted in the lower uterine segment, then what happens, the formation of placenta also takes place in the lower uterine segment. So this is the major cause of this placenta previa. The next is normally the ovum gets implanted in the endometrial site. If the endometrial site has any fibroids formation, so what happens, the implantation of the ovum takes place other than the endometrial site. So this is the other cause of the placenta previa. So next is a big surface of the placenta. So if the placental size is appropriate than the normal, so it can cause the placenta to hang down, that is nothing but which will be fall down to the lower uterine segment. So this is another cause. So next is if the placenta formed abnormally. So why the placenta will be formed abnormally means due to any lack of specific nutrients to the placenta, so it forms abnormally. So this is one of the cause. Next is multiple gestations. Multiple triplets or twins has a risk of increasing this placenta previa. Next, if the woman has several previous pregnancies also, it will increases the risk of placenta previa. And the next is if the mother had a habit of smoking during pregnancy also, it will increase the condition. Why? Because due to smoking there will be hypertrophy of the placenta, which results in a lack of oxygen supply to the fetus, that results in fetus death. Next is if the mother is older, means if the mother has age of 30 years also, it will increase the chance of placenta previa. Next is the placenta has been conceived with the help of the pregnancy has been conceived with the help of assisted reproductive technology such as in vitro fertilization. If the pregnancy is get confirmed by doing this in vitro fertilization also, there will be chance of increasing the risk of this placenta previa.